Well, it starts out when I was a kid. I had really great teeth, but as a teenager, when I went to my dentist, he looked in my mouth and he said, you know, you have great teeth, but it's a shame because you have such lousy gums, they're all going to fall out. That kind of freaked me out. That was the first I heard about the fact that I had this periodontal disease that was hereditary. And then now, up to my present, in the last 20 years, I have been getting excellent dental treatment, getting my teeth cleaned every 3 months, using an electric brush, flossing. And about 7 years ago, I was getting a cleaning, and my teeth my gums would just bleed real easily, and I was really having a lot of pain and sensitivity. And when the dental hygienist was trying to clean my teeth, I kept jerking and you know, because I was in pain and I was bleeding like crazy. She finally threw her hands up in the air and said, I can't handle this. I can't work on your mouth. And she gave me a couple of cards and said, you're going to have to go to a periodontist. So I went to the first periodontist, and he looked in my mouth and he said, you know, I'm just going to be honest with you. He goes, most doctors would have you go out and have, you know, 4 deep cleanings, and then they're going to turn around, and the inevitable is, you know, your gums are so bad. He goes, I can just look in your mouth right now and tell you what teeth you're going to lose. So you might as well just save you time and money and pull those teeth right now. Don't even bother with the cleanings, because you're not going to save your teeth anyway. Well, that kind of freaked me out, because I'm thinking, well, at least I can have my own teeth for the next 10 years. So I bolted out of that office. And then I went to the next doctor, and we did the oral surgery, and it was awful. The pain was, after the surgery, was excruciating. And I also had a reaction to the Vicodin that they gave me, which was very strong medication, a narcotic in fact, and I didn't want to take it because it was making me so sick. And he said, well, you have to, you had oral surgery. So I was laying on my back flat in bed, and if I got up, the room would spin, and I was throwing up, and my mouth was, my teeth had, when they used a prop to open my mouth, I have a very small mouth, they went too far, my mouth cramped up, so I couldn't open my mouth more, my teeth more than a little bit. I could barely fit a straw, so I had to just drink liquids for about a week, and the pain lasted for more than a week. And then up to the present, recently, this year, I was in the dentist office, and we got to the point again where the hygienist said, you know, you need to see it, you know, this just isn't working. The cleanings every 3 months isn't enough. You need to see a periodontist. And she said, you're either going to need to have this oral surgery where they wanted to cut my gums, fold them down, and scrape the roots, or you could do laser treatment. Well, I had never heard of that before. And I said, well, if it were your mouth, what would you do? And she said, oh, no contest. The laser treatment is far superior. And she said, Dr. Moran is the best. And she said, you know, the unfortunate thing is your insurance might not pay, because I have very poor insurance. And I thought, well, it doesn't matter. You know, I want to do what's best. These are the only teeth I have, and I want to try to save them. So I came in, and when I came in to have the procedure, it was amazing. I mean, they just had me lay back in the chair and count to 10, and then I didn't even get to 10. Next thing I know, I woke up and they said it was all over. And she said, you can just take an Advil tonight. Well, that night I didn't really have much pain, but I took the Advil anyway. The next day I didn't even bother, so I had no residual pain. There was no damage to soft tissue. And at my next appointment, when they went in, they were amazed at the results. When they went in and measured, it was like 3, 3, 3, and I actually had some bone regrowth. And now I brush my teeth. I have no more bleeding or sensitivity. I went in and had my cleaning a couple of days ago, and they don't even bother to give me painkiller anymore, because I no longer have the sensitivity and pain that I had before, and bleeding. I can't even remember now the last time that I've had bleeding of the gums since I had that treatment. And I highly recommend it. And I would tell anybody, whatever you do, don't let them cut back your gums and do the alternative. The laser is the only way to go. When I went to my regular dentist, and I went in there, you know, saying, you know, so he could see the results of my x-rays, because it was practically like a miracle, the difference, because I've had this 40-year history of bad gums and have such amazing results. And I said to my doctor, you know, how happy I was and how I wasn't having all my sensitivity and bleeding, and you know, there was such an improvement on the x-rays. And I said to him, I don't know why anybody would do this why you would even recommend for anybody to go any other route than the laser, since it's, you know, since it's non-intrusive and so successful. And then he said he's going to start doing laser treatments. Dr. Moran is wonderful. She's not only, I just can't say enough good things about how happy I am with the results. And she's just, this whole office, they're just great. They're so nice. When I come here, I feel like I'm coming to see friends. They put you at ease. I described some of my previous experiences. I can also say that the communication, they're compassionate, and they're honest, and you know, I've never felt like bolting out of the door like I have in a few other offices. It's just been a great experience all the way around. I highly recommend Dr. Moran.